I'm a hematology oncologist, and I have special interest in lymphoma, bone marrow transplant, and CAR T-cell therapy, and do some chronic leukemias as well. So I see patients after the diagnosis has already been made. So if you have an established diagnosis of a lymphoma or a certain chronic leukemia, or if your oncologist somewhere in another location thinks you might be a candidate for something like a bone marrow transplant or CAR T-cell therapy, then you could come see me. We can make this however you want to make it, what's going to be good for you and your family. If that means you come to see me every once in a while just for an opinion and you stick with your local oncologist, whether you want to travel here, 5-6 hours away and get your treatment here, whether you just get your bone marrow transplant and then you go back to your oncologist, I'm happy to make it work so that you're getting the care that you feel comfortable with. And then of course I have patients who I follow very closely here at Cleveland Clinic through their whole journey and get very close with as well. So one of the things that I'm interested in is CNS lymphoma, which is interesting because it's not like your typical brain tumor that most people think of. But there are certain times where I need to use my lymphoma part of my brain, stem cell transplant, and sometimes I need to bounce it off either the neurosurgeons or their neuro-oncologist colleagues that I have and get all of those perspectives to make the best plan for the patient. There is nothing better than giving a good news of a PET scan. And I love to bring up the pictures of the PET scans and put where we were at the start and where we are now and show all the improvements that we made. I don't have a lot of hobbies right now. I have a 2 and a 4-year-old, so that takes up a lot of time. I love it. My husband and I are lucky to have my mother-in-law down the street, so every once in a while she'll babysit and we'll go out to dinner, which is my favorite thing to do.